Yeah. Hey Nawaz, so good to have you. We're talking about the virus. Of course, I'm speaking to a genetic counselor, Pooja Ramchandran, who's a dear friend. I need to still talk about what genetic counseling is and what she does by helping people diagnose diseases that you might not know of, but it might run in your family. So she's going to quickly tell us about that before we close this session. So there you are, Pooja. I'm going to take you live on. There you go. So quickly before we close this, and we'll come back and do another session also. But we know a few truths we've got to follow. We've got to diligently do them. Social
Yeah.
distancing, wearing masks. Wearing masks is okay, you're saying, because it's not like there is a bacterial flora that needs to have its own space that we'll be blocking or something like that. No.
No, I mean, wearing a mask will protect other people, honestly, in case you are
More.
carrying something from it. So I think it's helpful. It's just respectful.
Right. Okay, that is
It's
one.
like, the Japanese do this on a regular basis. No, it's just Japanese culture to always be wearing a mask, just to be treating everyone else with respect.
I want to quickly now have you talk about what you have been doing. I know
Mhm.
the kind of testings you guys do at Mapmygenome.
That's
You are the
correct.
director at Mapmygenome, correct me if I'm wrong. If there is
VP.
any more senior positions they have designed for you, especially because you're so good at what you do, I don't know of it, you'll have to tell me.
I recently made VP, so that's what I am.
Woo! So I guess it's just got to do with a swab, and you can tell, you can read into the scientific future of the health of a person.
In some ways, yes. I like how you have asked the question and ended over here. So what it is personal genomics, right? Personal genomics is the way to analyze people's DNA, looking for the presence or the absence of a predetermined set of markers or letters that can increase your risk for having certain kinds of conditions like heart disease or diabetes or cancers and whatnot. And depending on the kinds of cancer that might be running through your family, you might need more diagnostic testing. Like the lady that I'd spoken about earlier on, if you have just family history of stuff, you might need genetic testing. If you have sickle
Right,
cell, for example,
right.
you might need genetic testing. So there's different kinds of genetic testing. So Mapmygenome does the personal genomics testing, the more diagnostic testing. They also do actually testing for TB. Can you imagine? Because there's different strains of, depending on the DNA of the TB bacterium, there is different medication that might work. So that way
So
you
you're
can.
telling me even before I have TB, I can get this test done and know if I am vulnerable to TB? Is that what you're
No,
saying?
no, that's not what I'm saying. I'm saying for patients who actually have tuberculosis,
Okay.
um, their treatment can sometimes be informed by what strain of TB bacteria you have.
Right, right,
And depending on that, then you can target that particular strain that is relevant for you with a
right.
particular drug that is known to be better for this strain compared to that strain.
Wow. From what I understand, two-pronged approach. One that can tell you what you may have in the future, depending
Mm-hmm.
on your the history of DNA in your that runs in the family. And two
Yeah.
is there is also something that is treatment based that the DNA
Yes.
test can tell you.
It's called pharmacogenomics. You can also test your own DNA to find out is this particular drug going to be well suited for you or not? Or you're going to go have a horrible reaction? Because you put 10 people on the same drug, sometimes 10 people have 10 different
Of course,
reactions
of
too.
course, of course, of course.
Um, and, and some drugs can end up having pretty severe side effects. Like warfarin, for example, it's a blood thinner. It's used to dissolve clots and can be life-saving for people who have strokes, for example.
Okay.
But if you have a certain gene change, you might have what we call warfarin sensitivity, which means that if you were given a standard dose of warfarin, your blood will thin out too much.
Ooh.
You think is good because the medicine is working very well, but if your blood thins out too much, it does not clot. And for people who have warfarin sensitivity, if they put on a normal dose of warfarin, then they can have internal bleeding, and that can be a life-threatening situation. So sometimes these kinds of pharmacogenomic testing can actually save lives in some situations.
So are you also telling me that for these kind of viruses that are doing the rounds now, gene testing can be done? There could be treatments that you're looking at for, for helping people heal and come over it. Is there something like that that's going on?
So right now there is no human DNA specific, uh, human DNA based treatment options for the coronavirus. Right
Okay.
now we're still looking for how can we deal with the virus. We don't know what is even going to fully treat the virus. There's some medicines, that have been designed for, say, Ebola, or in fact for HIV. Some of those same medicines are actually also showing some kind of helpful effects on the COV2 as well. Test your own DNA to find out what might be a better drug for you to deal with the coronavirus. You can test yourself for whether or not you have the coronavirus, and that's something that Mapmygenome is also just ready to launch. We're just waiting for because this is an RNA virus and it's not a DNA virus. So we're a DNA-based company.
Right.
So there is such a thing called scope expansion, which is, so instead of testing DNA, we're just waiting for our final approval for testing RNA. Now,
Right.
once that's done, we'll be able to put out their, testing kits so that more people can have access to testing. That's another reason why people are losing it, I think, a little bit, because people there weren't so many people being tested. And so now it seems that, oh, so many people are testing positive. Yes, we're testing more people now. So there will be a higher number of positive cases, but we need more tests. And we need that to be available and accessible. And so that is something that Mapmygenome will do as well. And also like sample collection kits and things like that, all of those things. Very, very important during these times. Yeah.
So some of the lineup of a few of the major diseases, like you said, that one can, counter way before the person is even affected by it.
Mm-hmm.
Can you list down a few which genetic testing helps with?
Sure. So when we think about what diseases can you intervene with, like from a prevention standpoint, these would be conditions that we call multifactorial, where there are multiple factors involved in the manifestation of a disease. One of the factors is a genetic risk. So that we can do a genetic test and we can find out what your risk is, so that once we know your genetic risk, we can reduce the risk from diet, from lifestyle, from, other things. And we can actually, come up with pretty strategic risk reductive techniques, so that you can prevent something from happening by making very informed choices about risk reduction and screening for targeted monitoring. And one of the most common things, like cancer, for example, is one of the biggest condition that you can actually identify your genetic risk for, so that you can put into place risk reduction. You can put into place sometimes chemo prevention even, and also regular screening, so that we in clinic oftentimes we talk about early diagnosis equals to good prognosis. So screening is very important. If you get diagnosed at an early stage, you are more likely to recover from it. The success rate, for example, for breast cancer, for example, I was actually reading up a while ago when I was trying to populate data from India. There's 5% of women in India actually get mammograms. 5%. And this is outrageous. And so we are getting diagnosed at stage 2 and stage 3, where success rates of treatment is 30%, 40%. And there's fewer cases because there's fewer cases being diagnosed. It's an ascertainment bias. And in the States, for example, there are many more cases, twice as many cases than in India, but half the mortality rate because they're getting diagnosed at stage 1, at stage 0 even, where success rate of treatment is like 98% and all of that. So if you can figure out what your genetic risk is, then you can reduce some of the risks that, risk management is what we call it. And then screen so that you can identify yourself sooner rather than later.
Right. And this is also something Angelina Jolie has done, and many other people have made it quite popular. Because her mum, I think, had it, and somebody else in the family had it. So because there was a heritage in the family, she wanted to get herself tested, and got the breasts removed and stuff like that. So her chances have gone down of having a breast cancer in the future at all. So cancer is one very big help. Other than cancer, anything else? Again, that's genetically. Again, you're saying.
I think there's certain kinds of heart diseases that if you know that you have a genetic predisposition for, then you can make adjustments to nutrition. You can make adjustments to your lifestyle. It is not uncommon to hear about, for those of you guys who are football fans, it's not uncommon to read these pieces of news about this football player just dropped dead and things like that. And it's quite common for cardiomyopathy, which is just a heart-related condition, to be prevalent amongst the average person. But if you're a pro-level athlete, then you push your system much more than the average person.
Yes,
You know, you and
yes.
I, we're not like, there's not a lot of cardiovascular activity, but if we'd be running on a field and when we're not playing a match, we're training intensively, then that can take a toll on your heart. And if you have a genetic predisposition to a particular kind of heart illness that could be life threatening, then you might want to make adjustments, or you might want to think about alternate career options even. And I know sometimes that is just heartbreaking, you know, because imagine, you know, being a kid, you wanted to always be a footballer or a basketball player, and then you get diagnosed with, you know, a particular heart condition or a connective tissue disorder like Marfan syndrome, and you're told that, listen, you could do this, but it could really put your heart at risk and you could basically die. And it's a heartbreaking conversation, but it helps people think about what it is that they would really rather do with their lives at a stage where they can still make that.
Right.
So,
Something that's become very popular in the past few decades, and something that is practiced, I think, very in a very big way in countries like Japan and Europe and almost all of America, is
huh.
multiple intelligence testing for children, which is done
What is
at
that?
uh, just like you are telling the genome patri that is very popular with Mapmygenome, which is of course telling you a scientific future.
Yeah,
We can
we call
also
it Genome Patri because like we
genome
don't believe
patri.
in the Janam Patri. So here is your
Yeah,
Genome Patri, huh?
it just sounds right. So multiple intelligence testing is something that tells the future of what a child can do in skill areas.
Interesting.
Yeah. So again,
Interesting.
that's a discussion we can have another time. So just like
Yeah.
multiple intelligence testing can tell what a child is good at in the future in
Mhm.
terms of skills and talents, I guess genetic testing is something that more and more people should kind of come forward to do, right? Whether or not you have a
They
history.
can consider doing it. I think, see, it is available, and just because it is there doesn't mean that it is right for everyone. You also have to think about how, you know, like if I do a test that is going to tell me that I have a grand risk of, you know, like ovarian cancer or something like that, then I have to ask myself, is this information going to help me to make the changes in my life? Or am
Right.
I going to end up being a really stressed out person from having this information that I can't now somehow unknow? So this is why genetic counseling is important. So that, I mean, just because something is available doesn't mean that it is appropriate. So just
Correct.
informed decision making is very important to be able to respect free will and autonomy to talk about the benefits and the risks and limitations. So one person
Right.
might do the test, another person might decide it's not for them. And we must be respectful of everyone's own decisions because it is, you know, it's their life that they have to live, you know, like
Sure.
forever.
Sure.
There's no point just making everyone do the test, okay, and then you're just like, oh my God, what am I going to do with my life? So if it is going to be valuable to you, then great. If it's going to freak you out, perhaps not for you.
Right. Well, just what the Janam Patri does to you is what the Genome Patri could also do to you. Help you as well as scare the
Yeah,
hell out of you. But of course,
help
there
or
is an
harm.
answer. There's an answer that, in genetics and in genetic counseling and at Mapmygenome, they do, I guess, which is try and also help people change their lifestyle. Can I do something? And this is my last question. Can I do something as simple as if there are some foods that don't agree with me and I'm allergic to something? Is there a test for that?
There actually is. So there's you can get like regular food tests, food allergy tests done on a clinical level, or you could go the Djokovic route, you know, tennis player Djokovic, and like he actually got identified with gluten intolerance, for example,
Yes,
and
yes.
just eliminating gluten from his food really changed
He's
his
gone
performance.
vegan.
Yeah, some and you can identify lactose intolerance, you know, gluten intolerance, or what we call celiac disease, and things like that. Yeah, these things are possible to do, and if you can make the adjustment